First of all, we're going to talk with Dr. Isabelle Leblanc, who is a family doctor. She worked in the front line, but she then had a training in anthropology and literature, and then she completed her medical studies at the University of Ottawa and her residency at McGill. She also was an assistant professor in the Department of Family Medicine in McGill University, and she also works and practices and teaches in Côte-des-Neiges in Montreal, and has been activist also with the organization Médecins Québécois pour le Régime Public since 2011. Dr. Leblanc, I would like you first of all to introduce yourself to this panel and introduce some notions that are important when we talk about equity, and why is equity so important? Absolutely, and I have only 5 minutes to do so. I am only going to tell you about some very basic concepts of equity, and then the panelists after me are going to tell more examples. What are we talking about when we talk about equity in healthcare? We talk about making sure that everybody starts out the same level in terms of healthcare. So it is estimated that only 40 to 50% of the people that are determined by biological factors. So what is their genetics, how do they grow up, some predispositions towards certain diseases or illnesses. Otherwise, 40 and 50% of their health is determined by non-biological factors, and these are modifiable, and it's not the same for everyone. So we have the social determinants of health. I'm not going to read each of these points, but you can read them. So you obviously don't have the same experience depending on your profile and the same experience. So are we at the same level or departure point, if you wish? So we have a lot of determinants, and these elements have a direct impact on our patients. I work in Côte-des-Neiges, and I can see patients that really don't have the same education level. Some people suffer from racism, they suffered from colonialism, and that impacts their health on a daily basis. Then some people come from world healthcare, if you want, because they came from other countries. Then you have some basis of analysis that actually check individual health versus rather than global health. I was listening to Dr. Brando. The system is as it is. There are a lot of blind spots, and equity is one of them. So you might have seen this image, the difference between equality and equity. The equity is to try to put everyone at the same start point. So everybody should have access to an optimal health care. They should not be confronted or limited because of their race, ethnicity, religion, sexual identity or gender identity, nor their age or social class or their socioeconomic background. So it is a key element of healthcare equity. When we talk about healthcare systems, well, they are made up for the majority of the population. When we talk about an equity approach, it means to make sure that we really answer the needs of all, even a particular user, not just the majority. And this is, as I said, a blind spot. We were talking earlier about information technology, about making appointments online, but some people might not even have access to internet for economical reasons or to a smartphone. Some other people who are, for example, homeless, or simply someone who just could not pay their phone bill at the end of the month and don't have or internet bill and don't have access to internet anymore. Then this is systemic, this barrier to equity. This is legal. Sometimes it is losing perspective for those people that take decisions. It's important to think of that. And one barrier to equity is that it also does not yield immediate results. So it's not going to change tomorrow morning. So the results are not going to be visible right away. There are three features of inequity in healthcare. The first one, it's systematic and systemic. So the differences are not aleatory, but they are created by a system that is unequal. Poorer people have less access. If we have a look at the lifespan, Hochelaga Maisonneuve, 74 years old. Nunavik, Westmount, it's 84, and Nunavik, it's 66. So these are not people who have biological differences, but really it is because of social inequalities that we can see these differences in terms of life expectancy. Now, the other aspects of inequality is that they are unfair. It's not fair that some people cannot have the same starting point as the others. And it's also something that's avoidable. As I said earlier, it's not a biological natural difference. It is, on the contrary, the result of things that could change by taking, for instance, collective measures as individuals, as organisms, as companies, as communities, at all levels of the government. So ideally, if we put an end to inequalities, you will see that equity can yield basically inclusion. Wow, I took 5 minutes, 2 seconds, and I'm done. Excellent, and thank you for this. And are you going to be with us with the Q&A after? Yes. Now I'm going to give the floor